All right, so today we're going to be going over the abdomen. First off, we would just be observing, looking for any abnormal hair patterns, any abnormal pulses, bulging of the umbilicus, edema, scarrings, anything that comes off as abnormal. We'd also be looking for any observable masses. If there were any observable masses, we'd have them turn their head and cough for us to see if it would rise or lower. The next thing we're going to do is first, before anything else, is listen to each quadrant with the diaphragm, about 15 seconds at each spot. After listening to each quadrant for about 15 seconds, we would then switch over to the bell, and now we're going to listen to the liver and to the spleen for friction rubs, see if there's anything going on in those areas. Next thing that we would do is then move on to auscultations. So for this, I'm going to listen to her aortic, iliac, renal, and femoral. So for aortic, I'm going to be listening with the bell again, just right above the umbilicus. Then it goes superior and lateral to listen to her renal. Move lateral to listen to her iliac. And then to listen to her femoral, it's going to be between her ASIS and her pubis, so we're just going to listen to the femoral. Listening for any abnormal sounds or noises. Next thing we're going to do is we're going to go through percussions. So for percussions, I'm going to start off by just percussing her abdominal region, starting at the mid-sternal, going to mid-clavicular, and then to anterior axillary. And then you would repeat on the opposite side, listening for normal resonance over the abdominals, and then with the liver and places like that, there'd be a dull. Next thing we're do is going to percuss the liver to find the borders. For that, maybe just press up for me a little bit. I'm going to start up superiorly and palpate down to find the upper border. And then once I found the upper border, I would mark that point, start down by the umbilicus, and find the lower border. Once I found that area, which for her is normal within 6 to 12 centimeters, I would then go on to percuss the spleen. For the spleen, I'm just going to have her breathe in and exhale. And what I'm listening for is any changes in the sound with percussion, changing from, say, a tympanic to a dull sound, indicating a splenic enlargement. Next thing I'm going to do is then palpate the borders of her liver. So for that, I'm going to have her breathe in, and every time she exhales, I'm going to kind of curl my fingers under her costal junction. Just feeling for the edge of the rib to see if it's any enlargement or anything of that nature. I would also then press on the liver, looking for Murphy's sign, just in case she had a problem with her gallbladder, which would indicate pain. I'll then come over and palpate her spleen. I'm going to have my hand just behind the back, hand over the top. I would breathe in and out, palpate her spleen, and then at this time I can also palpate her kidney by taking my hand in the small of her back. I would breathe in and out, seeing if I can palpate the kidney, which is pretty difficult. Next, I'm going to check her aortic pulse. So for that, I'm just going to feel bilaterally above her umbilicus for the aortic pulse. And it shouldn't be any wider than 3 centimeters, which it doesn't indicate on her. Next, I'm going to touch McBurney's point, which is basically between the umbilicus and the ASIS. This is going to be for pain with possible appendicitis. So I just press down on that point to see if there's any pain. But actually, before doing all that, I would want to palpate by first gently rubbing clockwise direction of the area, starting right lower quadrant, then going to the right upper quadrant, then to left upper quadrant, left lower quadrant. I'll then want to repeat again, but this time palpating deeper, feeling for clockwise, feeling for any masses. If there was a mass, I would have her then cough for me, just like a herniation check. If the mass disappeared, it would be an intra-abdominal mass, and if the mass persisted, it would be an intramural mass. Back to the appendicitis, another test we could do is a rebound check. So I would actually go to the opposite side of where the appendicitis would be. I would then press down and release quickly. The pain from the periosteum getting pulled could possibly indicate appendicitis. Next test I'm going to do is then do an obturator test for appendicitis. So for this, I'd have her bend her leg back and then internally and externally rotate it and asking her if there's any pain with that. I'll then have her things lay on her side. And then have her actively bring her leg back, check to see if there's any pain with that could indicate appendicitis.